Are you allergic to ragweed, penicillin, nuts such as peanuts? Those are examples of what is known as type 1 hypersensitivity. It's also called immediate type hypersensitivity. So what happens is that the first time we get exposed to these products, our body will make antibodies, and specifically type IgE antibodies. These antibodies will attach to the surface of mast cells. Mast cells are connective tissue cells, and they produce histamine, and they store histamine in the granules in their cytoplasm. So the second time we get exposed to that same antigen, the antigen is going to cross-bind to the IgE antibodies on the surface of the mast cells. That interaction is going to trigger the release of histamine from the mast cells. And that will cause the reaction that we call type 1 hypersensitivity. Now, sometimes those kind of reactions can be fatal because they can cause what is known as anaphylactic shock. In the anaphylactic shock, what happens is that we have a systemic reaction where the vasodilation of the blood vessel is going to decrease the blood pressure and is going to decrease the supply of blood to the brain. And that's why anaphylactic shock is a serious problem that can lead to loss of life. But again, type 1 hypersensitivity is a reaction associated with IgE antibodies and mast cells.